Your Health is a 6-week program that aims to equip young people with the skills and knowledge they need to make positive health choices around topics such as sexual health, blood-borne viruses, drug use and harm reduction, and mental health. The project is a collaboration between 4 organisations, including HepatitisWA, WA AIDS Council, Sexual Health Quarters, and Peer-Based Harm Reduction WA, formerly known as SiREN. And then we have Headspace join us as a guest agency for each program. For Your Health, we use group workshops rather than one-to-one learning. The workshops involve a range of theory-based learning but also hands-on activities. We find that using a combination of things allows information that needs to be learned in a more theory-based or lecture style to be learnt that way, but then it also gives the young people the opportunity to practice the skills that they need in a more hands-on environment. One of the things that makes Your Health different is that rather than having one person come out and talk about all of these different topics, which can be quite complex, we do have 5 individual people, each expert in their own topic, coming out and delivering the education, which I think is important. Even though the things we talk about, the topics we cover, are quite interrelated, to have an expert on each topic available to these young people is really important to make sure they're getting the most out of each session. It also gives the young people an opportunity to ask different people different questions. They might not feel comfortable asking me a question, but they might feel comfortable asking someone else that's part of the program that question, and I think it's important that they have the opportunity to access different people. So SiREN has been a big support to the Your Health program. They've helped us to develop comprehensive pre and post program surveys as well as post-workshop surveys. So as part of the program, the young people have to complete a survey before it begins, and then they complete one at the end as well, the same survey. They also complete a survey after each workshop so that we can see if they're learning or what changes in knowledge and attitudes are happening. We also were lucky enough to have Carlia at SiREN to help us complete an ethics approval to have Your Health formally evaluated, and lucky enough again to have that ethics approval approved in November. So that means that Your Health will be formally evaluated this year, which is really exciting, and that's something that wouldn't have happened without the help from SiREN. I think the biggest take-home message that I have from Your Health, or that I've learnt from Your Health and the young people that have participated in the program, is that the topics we cover, so sexual health, blood-borne virus risk, mental health, healthy relationships, drug use and harm reduction, are topics that young people really want to know about. They're things that they want to learn, but they don't necessarily know where they can access that information. It's really important that we have programs like Your Health that young people can access so that they can get the correct information in a safe environment for them. This is information that young people really want to get, and we've noticed changes in young people. We've had youth workers from the organisations where we've run the program say that they have noticed big changes in their young people, and they're noticing that they take a lot more responsibility for their own health and are making positive health choices. And also the young people themselves reporting that they're either making changes or they're starting to think about things a little more, and even helping their friends that haven't participated in the program, either giving them the information themselves or letting them know the agencies that they can go to for that information. We've also had several participants from the Your Health program access the clinical services from the agencies involved, which is really exciting. It means that, you know, they're getting tests that they potentially need that they wouldn't have gotten if they didn't participate in the program.